Now we've come to the self-assessment portion. This is a very important portion and it consists of 3 parts. I'm going to call it, what is my cottle maneuver score, what is my Mallampati score, and what is my TMJ score. First we start with the nose. So the cottle maneuver is a good indicator of how we're breathing at nighttime. What you do is you take a deep breath in through your nose first, and then you place your fingers beside your nose, you stretch the nose to the side, and then you take another breath. I don't know if you could hear that, but when I placed my fingers and opened up my nose, my breathing was a lot easier and less obstructed. This is called the cottle maneuver. If there's no change when you press on the sides, it's a minus. If you have a positive change, you circle the plus. Next we have to check how well we can breathe through each nostril. So you close one nostril and you breathe in, so that's the left nostril, and then the right nostril, and then you can put a minus if it's decreased, or you circle the plus if it's good breathing. You might want to grab a mirror for this part. This is for the nasal valve collapse. So when I breathe in forcefully, my one nostril squeezes down really thin. That's called nasal valve collapse, and it will create disturbance or increased resistance in breathing. So you can have nasal valve collapse in one or both. You can circle what's on the worksheet that corresponds to what you see. I wanted to mention again the use of nasal dilators. They're various shapes and sizes. Breathe right strips are external dilator. It works to open the nose like a little pup tent. And then we have the nose cones, which go inside the nose, but I find I'm continuously aware and feeling them in my nose, so I don't prefer those. We also have the use of a nasal decongestant spray. I have an example of that. It's called Xlear. It's only available in the States. It is non-medicated decongestant, so there's no steroids in there. It's based on a xylitol product, so from the birch tree. And I use that every night, and it takes about 20 minutes for it to kick into effect. It opens up the airway in addition to the Breathe Right strip, and for me, in addition to the oral appliance. So as you can see, treatment of sleep apnea is dependent on many factors. We need to really understand, or at least have an idea of some of these factors, so we can help ourselves have the best result from the treatment we're doing. Next is the throat. We want to look inside the throat by just opening your mouth and sticking your tongue out. You want to see what you can see in the back behind your tongue. Some people's tongues are really high. When they stick the tongue out, you can't see the throat at all. So when you cannot see your throat, when you open up your mouth and you stick your tongue out, it's a Mallampati score of 4. The Mallampati score was designed by people who are doing intubations. So when they have to intubate people into their throat, they want to see how difficult it is to intubate them. So a Mallampati score of 4 would be quite difficult to intubate. You can see also the diagram I'm showing, how the different levels are described, and how much you can see of the airway. Just to follow up on that, if you actually stick your tongue out and say ah, can you actually visualize the throat opening then, or still not? You can just put yes or no for that answer. Next we have the TMJ, which stands for temperomandibular joint. You want to put your middle finger and index fingers right on the jaw joint. You can open a few times to find it. And then make a note which side feels like it's popping or clicking, which side feels like there might be some pain when you're pressing, and also it could be that one side or both sides. You can also indicate on your sheet if you ever get lockjaw or if you get headaches and what time of the day are the headaches. Potentially also make a note under my notes as if you were on night guard at all. A clicking noise in one or both joints will cause an increased risk of changes in the bite, and this will have to be discussed prior to treatment. The use of oral appliance therapy has inherent risks of causing jaw issues or bite changes, as it is meant to be worn for the rest of your life. However, oral appliances have come a long way, and we do our best to minimize any side effects by giving what's called a morning reprogrammer. I'm going to talk about that in a minute. And this will minimize bite changes. Also minimizing the bite changes and jaw changes by keeping the appliance advancement to a minimum. So we want to find the sweet spot where the appliance is moved forward to give the best relief with the least amount of moving that appliance forward. This is going to be different for every person. That's why it's so important to have a custom oral appliance made that is made to fit your specific anatomy. We want to filter out these pre-existing conditions to also avoid any issues. Even if there are no pre-existing conditions, one must be aware of the potential. Also, having the oral appliance in might mean that sometimes you might wake up with some jaw pain. This again can be looked at in your sleep log to see if there's any extra stress that's happening in your life, or maybe you're more dehydrated, or maybe you're extra tired. All those things will also affect potentially clenching of the teeth, not just the breathing. So there's many factors that go into what might be causing the headaches and jaw pain. The bite maintenance is done with what I call a morning reprogrammer or a morning occlusal guide. This is a custom made piece of material that goes in between the top and bottom teeth, and then you squeeze down into it to allow the back teeth to come together. This is done in the morning when you take out the oral appliance. You might notice that your bite feels not correct. So you want to give yourself 15 to 20 minutes to see if the jaw will just relax on its own back into proper position. If you're still having issues, you can use this morning jig or reprogrammer jig in between your teeth that we have made for you in advance, and then you will bite down on that until your bite feels back to normal. If you forget to do this and you leave to go to work for the day, not to worry. You can check at nighttime again using the morning jig, the occlusal jig, to check that your teeth are touching. If you do this on a daily basis, you will definitely recognize or notice if there's any changes. This jig is also part of the rehab to make sure that the jaw comes back into proper position after using the oral appliance at nighttime. There's also a morning jaw exercise resource from the American Academy of Dental Sleep Medicine that may also be used. So this is another way to help relax muscles if they're feeling tense in the morning. You will develop your own TMJ maintenance routine based on these tips to allow for the best comfort and least amount of side effects. Again, depending on the type of sleep you have, will dictate potentially if you have still any jaw issues or jaw pain. The side effects should be temporary and last for a short while. If at any time there's any doubt, please leave the appliance out and give the office a call. Okay, Patrick.